1995 graduate of JABSOM and currently serves as an associate professor with the Department of Family Medicine and Community Health. She also serves as the Associate Director of the Office of Medical Education at the John A. Brown School of Medicine. Dr. Omori was selected by her fellow faculty to receive the 2015 Leonard Toe Humanism in Medicine Award, presented by the Arnold P. Gold Foundation in recognition of her commitment to compassion and sensitivity in the delivery of care to patients and their families. The title of her keynote address this evening is The Magical World of Medicine.
I'd just like to clarify, in your programs it says that I'm the Associate Dean of Medical Education, and I don't recall getting a promotion, so I'm actually the Associate Director of the Office of Medical Education. Dr. Kasuya is still the Associate Dean of Medical Education. Good evening, Dean Hedges, Regent Portnoy, Judge Burns, fellow faculty and alumni, family, friends, and of course the newest addition to our JABSOM Ohana, the class of 2019. So you may be wondering why I am wearing Mickey Mouse Maleficent ears on this auspicious occasion where I'm supposed to be talking about professionalism and compassion in medicine. And for those of you who know me, you probably think that I'm just being crazy. But actually, there is a very good reason, other than the fact that I truly do love all things Disney. So this summer, I visited Disneyland with my family, and it got me thinking about the similarities between medicine and Disney, and surprisingly, there are many. In fact, there are many lessons that we in the medical field can learn from both Disney, as well as from one of its most misunderstood villains, Maleficent. So first of all, there is the sheer excitement factor that is associated with Disney. Children all around the world, and many times adults too, like me, dream of the day when they can visit Disneyland or Disney World, and when they finally get there, it is nothing less than amazing. The parks are filled with wonder and amusement, and people witness things beyond their wildest imaginations. I would guess that this is the same type of anticipatory excitement that you felt about going to medical school. Many of you have been dreaming of this day for a really long time, and it has finally arrived. This past Monday, as you came to JABSOM for the first time as medical students, I saw the same wonder and awe in your eyes that little kids have when they step into the magical world that Walt Disney created for all of us. There is so much for you to do, see, and learn, and I'm sure that you can't wait to dive right in to start experiencing all of it. And I promise you that it will be incredibly wondrous and magical, and that it will be the best roller coaster ride you have ever been on. Fast-paced and thrilling, full of ups and downs, and sometimes it may even make your stomach turn. But hopefully, it will always fill your heart with joy and your soul with contentment. But while you are basking in the excitement of finally reaching medical school, and taking in all of the cool and exciting innovations of the world of medicine, you need to remember one of the more important similarities between our world and the magical world of Disney, and that is the unequaled professionalism that Disney expects from all of its employees, from the custodial staff all the way up to high-level executives. Disney has extremely high standards for its employees, which is the reason why everyone you meet greets you with a smile and a kind word, no matter how tired or hot they may be. Why their parks are always very clean, and why every cast member can answer most of your questions without looking irritated or inconvenienced. And it is why all of them put the needs of their customers first, and why we truly feel like it is the happiest place on earth. Having gone to 2 amusement parks on my trip this summer, I can tell you that there was a significant difference in the experience between going to Disneyland and the other unnamed park. The professionalism of the Disney cast members made waiting in the long lines, paying high prices for the tickets, food, and souvenirs, and putting up with the other park goers seemed trivial, and definitely helped us to have a wonderful experience. In comparison, though the other park may have had better rides, the employees were sometimes rude and didn't know what was going on. You could tell that they were tired and didn't want to be there, and it made the whole experience rather disappointing. The level of professionalism that Disney demands is even more important in the medical field, and is what we should all aspire to as physicians. Your patients are coming to you with needs and fears, sometimes at incredibly vulnerable moments in their lives, and they will expect you to treat them not only with competence, but also with compassion. As you don your white coats for the first time tonight and recite the Hippocratic Oath, do not simply go through the motions of saying the words, but I ask you to pay close attention to the ideals that you are committing to while taking this oath. You must push yourself to a standard higher than you ever have, for this is what your patients expect, but more importantly, it is what your patients deserve. This evening, your white coat ceremony is being generously sponsored by Dr. William Haining and Dr. Libby Char, in memory of one of my dear faculty mentors, Dr. Gwen Nagua. Dr. Nagua was the epitome of professionalism and had extremely high standards for herself as well as the students she taught and mentored. Which brings me to my favorite Disney villain, Maleficent. When I was applying to medical school, Dr. Nagua was the dean of students and was one of my medical school interviewers. I had heard horror stories of how scary she was, and after leaving her office on my interview day in tears, I believed those stories, and I thought I would never get in. Surprisingly, I did get in, and over the next 4 years, and for many more years later as her colleague, I gained a tremendous amount of respect for this physician, whom I initially was scared to death of. As we learned in the movie Maleficent, she also was feared by many and viewed as the mistress of evil, when in fact she was a kind and generous leader of her people and was just extremely protective of those she loved and cared for, and would do whatever was needed to fight for what she believed was right. This was Dr. Nagua, sometimes misunderstood by her scared students, but a fierce champion of professional integrity, compassionate care, and excellence in medicine, who only wanted to ensure that her students pushed themselves to reach their true potentials so that they could become the best possible physicians for their future patients. When you got to know her, you realized that she was sweet and caring like a Disney princess with the fire and determination of Maleficent. You will find many of these Maleficent-type medical faculty along your journey through medical school and residency. Do not be too quick to judge them or paint them as just another villain that wants to pimp you to death, but rather listen very carefully to what they are trying to say and teach you. And let them help you to become more than you ever imagined you could be. One of Disney's philosophies is that good enough is never good enough, and this should also be true for us. Dr. Nagua inspired me to be a better physician, and more importantly, a better person, and to never settle for good enough. As you start your PBL cases next week, you will often hear the term N9 for studying the main topic of a case. You should all know that this is actually short for Nagua 9, and was named after Dr. Nagua, who always emphasized to her PBL groups the importance of being thorough and knowledgeable about all aspects of a patient's illness. The other lesson we learned from Maleficent is that you should never judge someone before knowing their story. I believe this is extremely important for physicians to keep in mind when dealing with their patients. As many of you know, my clinical work and passion in medicine is helping to provide health care for the homeless. It is always disheartening for me to hear people making assumptions about these individuals without taking the time to understand what their situation really is, or thinking about who they really are as human beings and not just as a generic homeless person on the street. It is even more distressing when medical professionals make these comments, because I feel that we should know better and have a clearer understanding of the social determinants that underlie the reasons why many of these individuals ultimately become homeless. I ask my students that work in our free clinics to take the time to find out their patients' stories. Who are they? How did they get to where they are? How are they doing in their current situation? Many of our students find that their attitudes towards treating the homeless change significantly after truly learning about the unique individuals behind the ugly face of the problem of homelessness. And like with Disney, it is the story that is truly important. Your patients' stories will help you tremendously to provide them with compassionate and culturally competent care. So please ask the right questions and listen carefully to what they have to say. One day at our Y&I clinic, a student was obviously getting frustrated while interviewing one of our patients that was being seen for abdominal pain. This particular patient had severe liver disease and suffered several complications from this illness. The student was frustrated because the patient continued to drink alcohol and did not seem interested in quitting, despite having a very serious illness that was caused by her long history of drinking. He tried in vain to counsel this patient about why it was important for her to stop drinking, but the patient just got more and more irritated with him. When he came to present the patient to me, he was clearly exasperated and just wanted to move on to the next patient. I asked him if he knew how long the patient had been drinking, to which he replied, "A long time, that's what she said." I asked him if he had inquired more about how long she really had been drinking, or if he had explored with her why she felt she could not quit. He replied no. It turns out that I knew this patient and what her story was. And in fact, she had been drinking for a very long time. She had been drinking from the time that she was 3 years old. Her parents, who were both alcoholics, would give her alcohol to make her go to sleep. Alcohol had always been a part of her life growing up, and she had free access to all of it. It was the only life she knew and became a part of who she was. She had also tried to quit on multiple occasions as an adult, but being homeless and without many resources, had been unable to get the necessary support to enable her to be successful. After learning this, the student remarked that it was like putting on a new pair of glasses and truly seeing the patient for the first time. Though I understand it is more and more difficult in this age of endless paperwork and having to meet quality and performance measures, try your best to take the time to talk with your patients and find out their stories, and never forget what a privilege it is that they are sharing these very special stories with you. While it is extremely important and necessary to be a competent and knowledgeable physician, what will set you apart is your professionalism, compassion, and heart. Your patients will not care what your score was on your USMLE tests or how many honors grades you received in clerkship, but they will care about how you comforted them when they received their diagnosis of cancer, how you were patient with them at 2 in the morning when they were worried about their child's fever, and how you carefully explained the treatment options for their loved one's heart condition. Just as my experience at Disneyland was so much better than at the other theme park, you can truly make a difference in providing your patients and their families with a better healthcare experience. So finally, I also wore these ears to emphasize the importance of being able to have fun and not to take yourself too seriously. Because we deal with serious issues that sometimes have life or death consequences, and we are constantly burdened with the bureaucracy and red tape of the business side of medicine, it is extremely important to take care of and nourish our body, mind, and spirit so that we will avoid burnout and not get the humanity beaten out of us. So every so often, let your inner child out and do the things that truly make you happy. Make sure you spend time with your family and friends that have supported you and will continue to support you through some very hard times. Exercise, go to the beach, read a book, play with Spiky. Find those things that will help you to recharge your batteries and make them a part of your usual routine. You have entered a world of heroes and villains, happy and sad stories, long journeys and adventures, and many daunting challenges. I urge you to face these challenges head on, always remembering who you are and why you decided to become a doctor in the first place. One of my favorite characters of Disney is Winnie the Pooh. So I'd like to leave you with some very wise words that Christopher Robin once said to Pooh Bear. Promise me that you'll always remember that you are braver than you believe, stronger than you seem, and smarter than you think. Thank you so much for allowing me to be a part of your very special occasion. I really look forward to working with each and every one of you over the next 4 years. Welcome to the magical world of medicine.